Hi there, I'm Emily Schaller, and you're watching the RoxyF Boltcast. Before we get started, there's a few things we need to go over. First off, nothing on this podcast should be considered medical advice. Medical advice should only come from your doctor. Views expressed on this podcast are solely opinions of the guest and not necessarily opinions of myself or the RoxyF Foundation. Enjoy this episode of the RoxyF Boltcast. This episode of the RoxyF Boltcast is sponsored by Vertex.
I'm Reba. I'm 39, diagnosed with CF at 38, and I live in Houston, Texas.
I'm Kylia. I'm 15, and I was diagnosed with CF at 3 months.
Diagnosed at 3 months, Kylia. Reba, tell us about that diagnosis. Was it caught with newborn screening, or were there symptoms early on? Just kind of walk us through how the diagnosis was started, and then what the prognosis was for Kylia once she was diagnosed.
Yeah, so Kylia was born prematurely at just about 6 weeks early. Had a complicated pregnancy, didn't really know why, but she did test positive for CF on her newborn screen. However, nobody was concerned. Our state, we lived in Kansas, and CF had just been added to the newborn screen like 3 months before she was born, and they had what they were calling a lot of false positives, and she didn't have any symptoms. And so they kind of very casually said, no, she doesn't have symptoms. Come back for sweat testing when she's 3 months, or if symptoms occur. Thanksgiving night of that year of 2008, something was off. She was really, really fussy. She was just not herself, but she was just a super chill baby. And so I knew something was wrong. So I decided to take her in to the hospital where she was born. I was a new mom. I was a scared mom. And once we got there, they were like, well, she is not going to see a neonatologist. She may or may not see a pediatrician even, depending on if the resident deems it necessary. So I left. And then just went to the children's hospital. And so she was actually admitted that night for jaundice. And her being fussy, they just said, just colic probably, which is really weird because she hadn't been a colicky baby. But it was a blessing because it got us to the hospital that night. So she was admitted because she was jaundice. And she couldn't tell. I'm familiar with jaundice. She didn't have the typical yellowing. Being black, it's a little harder to tell unless it's, super, super progressed. And so they actually noticed it mostly on her gums. And I still never saw it. Like, I'm not seeing what you're seeing, but I'm glad you're seeing it. So she was admitted. And of course, in the ER, I told them that, here's where she is with this newborn screen and this subsequent testing. We don't have answers. So they were aware right away. She was there in the hospital, I believe, for around 5 or so days. Throughout that stay, she had a liver biopsy because, of course, we wanted to figure out why she was jaundiced at just about 3 months old. And I remember the day of her biopsy, afterward, they came back to just do standard labs to check for clotting and all of that. And they decided to go ahead and run the blood test for CF. Blood test results were in the very next day. And confirmed. However, that morning before we got the confirmation, I knew because it just so happened that was when she had her very first symptom of CF, that very morning. I actually went to change her diaper, and lo and behold, there was the mucousy stool. Hadn't been there before at all until that morning. So when like 5 or 6 people walked into the hospital room all at one time, we just literally made eye contact, and I just started crying. Like, I knew instantly. So hearing the words, it wasn't as hard, I don't think, just because like I already knew in that moment. But at the same time, hearing the words literally is changing our life.
Okay, so you had Googled it before, though, which
I did.
We always say don't Google CF.
And I did it.
Had you heard about CF beforehand?
I didn't. And like I mentioned, I had a complicated pregnancy that we never knew, like why. For whatever reason, she wasn't getting enough blood and oxygen, and I was healthy, right? And they couldn't figure out why. And when they were trying to kind of get to the bottom of why these complications were happening, the doctor automatically checked to see if I had a gene for sickle cell, because Black. They never actually checked to see if I had a gene for CF, just something I found out later.
So this is your first baby, how did your life change? I mean, you started on enzymes.
started the pancreatic enzymes, of course. We did the hand CPT, so we did the clapping. We had the little clappers, and then we just did all by hand. Those wrists really got a workout. But yeah, we did all of that. She did get a vest at about 16 months old, 16 or 18 months. So she got it super young. And we were actually able to get that approved through insurance because she had really, really bad reflux. And they wanted to help anything that they could to kind of get mucus out, get it moving. And so insurance did approve that. So she did start her vest at 16 or 18 months. And we eventually added in another med at night to help loosen mucus.
All right, Kylia, so you're 15 now, correct?
Yeah.
And then CF is all you've known your entire life. Do you remember like the thought or the feeling of like, I don't want to say being different from other people, but I'm going to guess like for me, it was around like second or third grade.
I would say around second grade as well, when I would go to school and I would have to do everything different than all the other kids, and the teachers would ask me questions and worry about me and like try to stop me from, well, not stop me from doing things, but be like, oh, are you able to do that, or can you not do that?
Did you appreciate that they would point that out to you, or would you rather just advocate for yourself and say like, I can't do this or I don't want to do this? Was it kind of weird that they would ask you in front of the other kids, or ask you about if you're able to do stuff?
I didn't really like that. I would rather just say it myself, because then everybody's like, oh, what are they talking about? What's wrong with her?
Yeah, I like that too. Rather like, this is my thing, so let me talk about it, right? And I think that can affect how your childhood goes and your schooling goes, right? If somebody else is calling you out all the time. Did you have a discussion? Because my parents really didn't talk and be like, hey, you have cystic fibrosis. Like I would go to clinic every 2 to 3 months, get weighed, get blood tests, do a PFT, and then it kind of just made sense. But did you have a discussion with each other about it? And
we actually did. I mean, it's when she, once she could talk, right, and once she could do some things on her own, I did a kind of just age appropriately, it's time to do your nebulizer. What's this medicine for? This helps open up your lungs. Just like very, very just little nuggets here and there.
I think that's cool. And having the way you did it, I think sets her up to be empowered, right? So you would go to clinic, and would you have the discussion with the doctors and nurses then, and mom would sit back, maybe the little older you got?
Yeah, recently I've been telling all my medicines, and when they ask questions, I answer them. Sometimes with some stuff she has to answer, but I'm going into adulthood, so I'm learning how to do it on myself.
That's awesome. I think, okay, so after, you guys know, like hearing physicians talk about transitioning to adult care, and some kids are some they want to kick out to adult care early because they're a pain in the butt, but some, like, it sounds like you, Kylia, like you will be ready because your mom has done such a good job with you, like teaching you about the medications, empowering you, you advocate for yourself, like that'll make transition for you and the other CF care team so much easier. And you just are confident. It's awesome.
We go into clinic now and I sit there and I wait on my turn. I go, this is her clinic visit. This is, she keeps her medication list in her phone. I don't, she does this. She leads her appointment. She talks about her needs. She is 100% advocating for herself.
How's that feel? Like being in control of your own healthcare?
My mom, she always wanted me to have some say in everything, until I could have a say in everything. So I've always had a little piece of that, but now I'm adjusting to it. I'm a little nervous about changing clinics because I've gotten used to everybody.
Yeah, I know you can. It took me 25 years to transition. I think your mom heard me say that once.
She's bargaining, like she's trying to stick around though. She loves her clinic, so she's already in those conversations like, how long can I stay here? So
I know, and the more charming you are, they'll let you stay longer. But I will say it's harder the longer you stay.
Yes.
Like I wish I would have gone earlier, because it was the hardest moment for me was switching to adult care, because I was leaving this family of people. So I'm like, just rip that Band-Aid off and get out of there early. Because the next care team will be just as good and caring, right? And super important part of our lives. And we'll talk about care teams in a little bit. How's your health now, Kylia? Are you, what do your treatments look like? How are you feeling?
For treatments, I still do the vest. And I am on a modulator. I started that.
So she started the first when she was 10.
Okay.
And then switched, I guess, what was at age 12 to the other.
It's changed everything, really. Sometimes I forget I have CF in moments.
Crazy. I mean, when you were diagnosed, Reba, did you think like something like this would be available?
Wildest dreams, you know? I mean, it's what we hoped for. It's what I remember, you know, you talked about like what that looks like for her. And at the time of her diagnosis, life expectancy was 35. And so it was kind of like one of those things that I knew would happen, but I honestly wondered if it would happen in her lifetime, if it would happen when it was too late. You know, kind of what would that look like for us? Would that be something that would even be available? Kylia is double Delta, so you know, we do have that on our side, right? You know, to where there's the benefit of the bulk of the research there. And then you feel guilty in saying that too. You feel guilty in being grateful for that. But yeah, so I noticed differences. Fortunately, she's never really had a baseline cough.
So let's shift gears to your diagnosis. And then I want to talk about what it's like to have you both living with CF. It's wild. I remember following you on Facebook when you were going through the diagnosis and just being like, whoa, 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 like my mind was blown. So just give us the rundown. Like, this is so wild, and we want to hear about it.
So backstory, I've always had GI issues that were just chalked off to be IBS. I've always had chronic sinus issues. I've had one sinus surgery in need of another, just normal sinus issues. I've always had lung issues. I've had a baseline cough. Kylia has not. Progressively since 2011, I have just had at least once a year a really bad lung infection where they just say, oh, it's bronchitis, turns into this cough that would last literally 3-4+ months. And I would just be pumped with antibiotics and steroids and whatever the new antibiotic or bronchodilator steroid inhaler that was out, try this new med, but nothing to call it. So in 2011, was the first time that I mentioned it to my PCP. And I'm like, have my daughter, she's 3, she has CF. I know I've got this gene, right? I know that. Like, can we explore this? My doctor, been my doctor since I was 14, he, without a doubt, said yes. So we did a sweat chloride test. It could not have been the more perfect results for my sweat chloride test, 100% normal. So that was the end of that conversation. We didn't revisit. Again, starting in 2014, my lung issues, that annual started to become semi-annual, and again, worse and worse and worse. And the cough would last, and I became the cold air was more irritating, and just walking, doing regular activities became a little bit difficult with my lungs.
I remember it clearly.
Yeah, it was bad. It was really bad. 2 or so more years go by, and we're still just trying another inhaler and another inhaler, and just all of these things that nothing's working at all. So I finally see him again last spring, and I'm like, I'm not getting any better. I don't know what to do. And we happen to, in conversation, mention again, my daughter with CF. Happens to be the same pulmonologist who completely forgot that I have a kid with CF and wanted to order the same test again. So he sent me an order for the same test, but I ended up, kind of like, hey, we've already done this same test. What about this one? And so what we did was the entire gene sequencing. And that's when I got my answer about 10 weeks later.
Whoa. Okay, so you had to wait 10 weeks.
10 weeks. 10 very long weeks. Very long weeks.
I would have been stressing. I would have been stressing.
Yeah.
And Kylia, you remember your mom, getting sick, right? And, being more sick than you. How was it to watch your mom go through this? And then also get that initial that final sequencing test, like how was that for you?
It was not good that she got the confirmation, but it was good so she could get what she needed. It's funny because I would try to push things on the doctors. I was like, she needs this, she needs that. And, and then my mama would be like, Kylia, chill out. Because I would just bombard the doctors.
She's my advocate. She was on FaceTime with my first appointment, and she's like, is she gonna get a vest? And what nebs is she gonna be doing? And like literally, and I'm just like, okay, I've clearly done it, right? My work here is done.
Oh, Kylia, you are the best advocate.
She is.
Good job, man.
She is.
Getting that stuff done for your mom. Obviously it must have been a relief to finally have name to what you've been feeling. I know we interviewed Skylar last month, and her podcast came out, and she was diagnosed at 22-ish, early 20s with CF after a lifelong of you have sinus issue, you have allergies, like not a diagnosis. So it was a relief to her. Like, how was it for you to get that diagnosis?
It was exactly that. It was a relief, but then I'll also say, I had this conversation with someone before, and I feel like I've gone through the stages of grieving as well. And it's been anger because I've known something is wrong with me, and it's like that kind of gaslighting. Oh, it's just this. Oh, it's fine. People make you feel like you're doubting yourself and what you're feeling, and and I never said that I thought I had CF, but I know that these are the things that are happening with me, and it is because of something. So I needed someone to help me figure out what that something was. So I did. I felt a tremendous amount of relief, first of all. And then at different times, some days I would just be mad. If we could do more than just that standard panel, if we could not necessarily rely just on a sweat test. And I say that because, Emily, after my diagnosis, literally probably a week later, one of the first things that I did was have a sweat test done again. And guess what? Still normal. I was only diagnosed by that gene sequencing. That's where I have a little bit of the frustration part of it. I know when I'm having a bad day what it is, and I know that doing those extra treatments will help.
The late diagnosis, of course, for you, Reba, but then both of you and how you're living your life now and how it's changed is really wild, but it's important for people to see. And I think of self-advocating, and I know it can be done two ways. And Kylia, you're advocating for yourself at CF Clinic, and you advocated for your mom to get a vest and get treatment started with her diagnosis. But Reba, what kind of advocacy do you think needs to be done to shine light on listening to somebody who knows something is wrong, and especially like in minority populations in the country, like sometimes we're overlooked, right? Because we don't believe that you could possibly have CF. So tell us what you want to see with advocacy, and you can let it rip here because we'll get it out there.
It has to start with you getting out of that white person, small, looking like they are malnourished. CF comes in all forms. And I have never known that, diagnosed at 38 years old. I haven't always been overweight, but I've never been super, super small. I would have never, even in my childhood, even at birth, at any place in my life would have ever fit that look. We've got to start at the very basics of just getting outside of what CF looks like. I've been fortunate enough to be part of a working group for the CF Foundation that was working to kind of provide material and education for minorities, for people of color. But it really is going to have to start with education. So it's going to be re-educating those who have already been in the community. And then also getting people who look like us, right, in those spaces. As a Black woman, a lot of Black people, a lot of minorities, there's already a distrust in healthcare. I work in healthcare, and I still have that feeling. And after not being diagnosed with something I was born with for 38 years, I'm still struggling in that space. We've got to stop creating spaces for people to not trust the healthcare providers.
Agree, listening, but it's just like opening up CF and trying to get them to think outside of what they're seeing in the textbook. Is there anything like you would want people to know about what it's like to live with CF, or just to get it out there? Because I think, like your mom was saying, there's this cut and dry, cookie cutter idea of what CF is, but that's outdated tremendously.
I like to tell my story to be able to help change that. Even with my friends, they know all about CF. They notice when I don't feel good, or they advocate for me with teachers and stuff. I feel like sharing is the most important part of it, getting everybody's stories out there so people will actually listen and see how different each one of us are.
I love that. Yeah, my friends in high school, I started in elementary school, kindergarten with them, and then went 12 years, and they'd be like, you need to tune up. You're coughing more.
Yep.
Like, they can notice.
Yes.
And it sounds like your friends are pretty observant too.
Yeah, I love that.
Anything you would tell your younger self with going through life with CF? Anything you would have done differently or told yourself or set yourself up for where you are now?
So I feel like I would tell myself to open up and actually talk to people, my team, my care team, my mom, my grandma, whoever. And I would also tell myself to be prepared for changes because I was diagnosed with cystic fibrosis related diabetes, so that was an adjustment, and I wasn't prepared for that at all.
That's great. I think that's good advice for other people with CF also. Like, that's a really smart answer, and it resonates with me because I did the same thing. I never talked about my feelings and being scared. I just I can do this. I don't need anyone to know how I'm feeling.
And I say her CFRD actually snuck up on us a little bit earlier. It appeared before she had her scheduled screening for it, which is why she's saying she's unprepared, because it did. I started noticing symptoms before it was time. So
yeah. I felt like I even noticed it myself because my grandma has diabetes, so I saw the signs and I was like, that's when I actually told my mom about my worries.
Yeah. You do very well. I'm proud of you. Very proud. Yeah, absolutely. And Reba, what are you hopeful for with the future for you, Kylia, CF? Anything that you can share with us?
The future, right? That's just it, that there is a few, because my first thought was, okay, I physically look this way, I'm being diagnosed, but what does that mean? Life expectancy, where am I in this picture, right? Because at 38 already, I guess really that is what I'm hopeful for, the future, every day. So with the advocacy that Kylia and I have been doing with her travel and her speaking lately, just every moment we get, however we need to show up and be present in that day, in that moment, is what we're trying to do. I think it's just been a kind of reminder to not take a moment for granted, and we're just trying to be more present in every day. Literally putting the phone down. When we were just traveling in Ohio, I don't have nearly as many pictures as I normally would because my phone was away, but that's okay, I have the memories. I'm super excited about the new therapies that are becoming available. I'm super excited for every parent to be able to celebrate and take those silly photos of that first day your kid takes that blue pill, or that, that has that new therapy or that new treatment or that new neb or whatever that is. I want that for every parent. And I also think it's important also just to note that one thing I never did with Kylia was we never lived in a bubble. Kylia did gymnastics and dance from 1.5 years, and t-ball and horseback riding lessons and karate and I don't know, all the things. If she could do it, she did it and does it. So still keep doing that. And now I think for me, the same energy I had for her with we're gonna live, I'm kind of feeling that a little bit more for myself. It's a reminder to just keep moving forward and not taking things for granted. I think I'm just excited about personally exploring all the things that I've maybe been hesitant to explore before, and knowing to trust myself. You won't be able to convince me to doubt myself again.